I'd wake up on the Tuesday in the morning and I just wouldn't be hungry. And at the time I was diabetic and my blood sugar levels were high. So, my blood sugar levels are going up because of the dawn-affected dawn phenomenon, but outside of the normal range. And my body is obviously secreting insulin. It just seemed like eating would be adding fuel to a fire that I'm trying to put out. So, I know young women.
I think your story is so interesting because there's a lot of concern about fasting for type 2 diabetics. And when you have a lot of stored sugar, I just want to make sure everybody understands the dawn effect is where the liver is going to pour out that stored sugar in the middle of the night. You wake up and your blood sugar is higher, ketones might be lower. But that's what the big concern, that's a part of the big concern with type 2 diabetics. How long did you see when you were fasting? Did you keep seeing spikes of blood sugar as your body was going after those reserves?
Yeah, absolutely. And patients do too all of the time. Like I would have patients come in the clinic so concerned. They got a 30-year history of being diabetic, type 2 diabetic. They got a 15-year, 20-year history of being on insulin. And, they'll be a day and a half into their fast and their blood sugar levels will still be around 180. Yes. And it's just like, well, you are a very sweet individual. And I think what people don't realize is with a lot of the diabetic medications, they all have unique group classes and those classes have unique functions. They don't all function in the same way. But in the bigger picture of things, it's, imagine you have a really dirty kitchen and you've got company coming over and you don't have time to fully clean the kitchen and do the hard work. So you take all of the rubbish and you put it in your basement. You've got a cleaner kitchen for the company, but your house isn't cleaner. The rubbish is just elsewhere in the house. And that's what a lot, not all, but a lot of these diabetic medications do is they treat sort of the symptom. It's like, okay, the blood sugar levels are high. It doesn't treat why it's high. All right, let's just take the sugar out of the blood and, let's put it elsewhere and cause disease and, turn it into inflammation and all of this awful stuff. So, we keep eating, we keep taking our medication. The medication removes it from the blood, but our bodies are no cleaner. They're actually becoming dirtier and dirtier and dirtier. And eventually it becomes condemned as a toxic hazard. And, that's where we really see, like, we have people come in 400, 500 units of insulin, 3 different types of insulin, oral medications on top of that. Like, it's just wild. And it's not working. Like, it is not.
And that part is like, to me, that's malpractice. Like, if you keep throwing a solution at a health problem and it's not working, it's time to take a different approach. And again, I want to just applaud what you guys did with type 2 diabetes because you stood up for that and you said, I'm going to do this differently. What's the most, just so that in case we have any doubters listening to this, what's the most amount of weight you've seen somebody lose and the most dramatic A1C drop?
Yeah, so the most amount of weight someone that is lost that we've tracked who's been in our program was around 225 pounds.
How long did that take?
So it's, it doesn't take forever, but it does take a couple of years, okay. 2.5 years for that particular individual, and they had some health challenges along the way. So, it's not wild. For some people, I've lost like 80 pounds in a year. I saw someone on, our group the other day lost 93 pounds in 8 months, and sometimes it takes 2 years, but you lose it and it's sustainable. And that's the great thing about it because you're fixing the problem, which is great. We've seen A1Cs within 6 months go from undetectable because they were so elevated down into 5.8 within 6 months. And then to get it from 5.8 to just, 5 or 4.9 takes about another 6 to 12 months, depending on the individual to do. But in 6 months to get it, from this undetectable range, and their glucometers constantly weren't working and the CGMs were a bit of a failure on them, but to get it down to 5.8 in 6 months was pretty fantastic.
It's crazy. I mean, nobody gets those kind of numbers with medication, do they?
No, they it's just so wild. We published some case series that BMJ has been very kind to fasting because we've had so many issues. So this is probably wild, and I don't know if I'm going to get in trouble for saying this, but Jason and I, when we had our clinic in Toronto, we're all online now. We had such great data. and we wanted to do a retrospective chart review of our data. So we had to go to a research ethics board, which I had gone to 9,000 times. I mean, it was essentially my job up until that point.